Greetings and welcome to another Oral Pathology Tuesdays. Every week we get together to talk about topics within the diagnostic sciences of dentistry that also intersect of course with medicine, and that is oral pathology, oral medicine and oral radiology. This time we are here to celebrate some of the great achievers who won the best prizes at the International Oral Diseases Case Presentation Conference that got over just 2 days back. That was on this Sunday. They made some very great presentations, and we are very happy to have them with us for a number of reasons. One is, of course, the great work they did. The second thing is, we have always been, in part at least, about promoting the work that we do as oral pathologists, oral medicine, oral radiology, oral diagnosticians, let's say. So, the best way to prove to the world that we exist and we do great work and essential work is, of course, to showcase that work. And today we are going to have these eight wonderful colleagues and youngsters with us who are with us to share what they did, how they did it, how they won the prize, and with that, let me just announce their names. So we have with us Dr. Swetha Acharya, Dr. Kugendran V. Rajendran, Dr. Sourendra Basu, Hritika Mehta, Dr. Saikat Chakraborty, Dr. T. Maha Lakshmi, Dr. L. Jebisha, and Dr. Amulya Thota. So, with that, I should just bring them in so you can meet these wonderful colleagues. Yes, welcome, hello, and welcome everyone.
Hello,
Thank
ma'am.
you for
Thank you,
joining
ma'am.
us. You're most
Hello,
welcome.
ma'am.
Hello, ma'am.
Hello, hello,
Hi,
hello.
ma'am.
Yes, hello,
Hello.
everyone. It's rare for me to have the fun. Having many people with me here is great fun, but I rarely do. It's normally limited to just one or two people. So this is a very nice and different experience, actually, even for me. So yes, Dr. Amulya. Yes, okay, you're back. I'm glad everyone's cameras are on and everything is fine. Yes, oh, we have Professor Hiller also with us. We have Dr. Bhuvan, we have Dr. Guru Rajarao, and we have Dr. Sandhya. And a warm welcome to all of you. Thank you for joining us. And yes, for this celebration that we are having of these great achievers. So let me start from the beginning, the way we are arranged. We will just go as per the arrangement of the windows. Okay, so let me start with Dr. Swetha. So, Dr. Swetha, where are you attached? I mean, what do you do otherwise?
First of all, very good afternoon, ma'am, and congratulations for your meticulous organization of this conference, case presentation conference. And we enjoyed it presenting and participating in this forum. Myself, I'm a full-time research scholar in the Department of Oral Pathology in JSS Dental College attached to JSS University. Formerly, I was working as an associate professor in SDM Dental College.
Wow. Okay, that's nice. All colleges and institutions, actually, I do know about, so that's nice. Right. So, let's go
Thank
with
you,
Dr.
ma'am.
Amulya. I guess we have lost you. Can you come back? Okay, let's give us some time. Let's go with you, Dr. Jebisha. Can you tell us where you are from, what you're doing now?
Good afternoon, ma'am. Thank you for providing this great opportunity. I am a postgraduate student from Chettinad Dental College, ma'am.
Okay. Postgraduate students, that's nice. Yes, Chettinad. Where is Chettinad Dental College?
Chennai in Kelampakkam, ma'am.
Okay, fine. Right. Dr. Amulya is still not back. Let's go with Dr. Saikat. Yes. Can you tell us where you are from and what you're doing?
A very good afternoon to you, ma'am. And first of all, let me take this opportunity to thank you to give us this platform to showcase our work. I belong to Panchkula, the northern part of India. I run my own oral pathology biopsy reporting center and the diagnostic center. It's an exclusive oral pathology practice which I do, and I have been doing it since 2019. Um, Along with the various other dental surgeons, oral surgeons, as such dental surgeons alike, who keep sending me the biopsies, and then all. Basically, the tagline of my organization is any lumps and bumps in the mouth or tongue, I am the go-to person. So
That's a good one. That's actually
yeah,
a
this is what I do, ma'am.
Oh, wonderful. And I'm glad that you're doing full time oral pathology practice. That's really very nice. Okay, let's come back to Dr. Amulya. Yeah. Yeah. Can you tell us now where you are located and what you're doing? Dr. Amulya, your mic is off. Can you hear me? Will you raise your hand if you can hear me? No, you can't hear me. Oh, that's a pity. Okay. Let's go with Ritika. Miss Ritika, yes.
Very good afternoon to Mandana ma'am and everyone here. My name is Hritika Mehta. I'm an intern at DY Patil University School of Dentistry in Navi Mumbai.
Yes. And which year? Sorry, which year are you in? I got
I'm
distracted
currently
for a moment.
pursuing. It's all right. I'm currently pursuing my internship.
Your internship. Correct. So you're almost there. Cool.
Yes, almost there. 6 more months.
6 more months. Okay. At that point in life, it seems like a long time, but believe me, it's not. Right. So let's go with Dr. Kugendran. Yes. Where are you and what are you doing?
Hi, a very good evening to everyone. I'm Dr. Kugendran and I'm from School of Dental Sciences, University Science Malaysia. So I'm basically from Malaysia actually, and I'm a pediatric dental resident. So I think I'm the only pediatric dentist probably in the entire conference, might be. Yeah. So thank you very much for giving me this opportunity to be part of this conference.
Yes, that was
Yeah.
rather nice to know that we had a non oral pathologist, oral medicine kind of a presentation of from another department. It was really nice, and that too you did so well. Yes.
Yeah.
So let's hear from Dr. Surendranath Basu.
Hello, ma'am. Good afternoon. Thank you for providing this platform where we presented all our special cases and we learned a lot from the other speakers as well. And myself, Dr. Sourendra Basu. Currently, I'm working at Maulana Azad Institute of Dental Science, Department of Oral Pathology. I'm working there as a third year postgraduate resident. And previously, I have completed my BDS from Dr. R. Ahmed Dental College and Hospital in Kolkata.
Okay,
And now I'm currently staying in Delhi.
great. So did I cover everyone or did I forget anyone? Dr. Mahalakshmi, did you speak? Oh dear. Okay, I think she also can't hear us. Can you hear me, Dr. Mahalakshmi? Dr. Amulya, can you speak now? Oh, okay. Sorry, normally we have a lot of run up testing with everything. I know I cannot hear you, but this time we haven't. Can you try speaking now, Dr. Amulya? Try speaking. No, sorry. Okay. No. All right, so let's just go on. Sadly, we cannot establish that. Let's start with now. Let's reverse the order. So, Dr. Basu, what made you choose? What case did you choose, and what made you choose it?
Ma'am, have chosen the case of mature cement-ossifying fibroma as we have gave it a diagnosis. But during the slide review process, as we see the regular slides, we saw some areas which were looking like cementosseous dysplasia, and our we could not agree on a single diagnosis. And a group of our pathologists, they were in terms of cementosseous dysplasia, and another group they were in the terms of cement-ossifying fibroma. Then we all sat together, have gathered all the data from starting from the incisional data, the radiographic data, everything. We have examined everything, and after that we looked up to the latest 2022 classification also and the literature also. After that, we presented is that yes, the maximum area is looking like mature cement ossifying fibroma, and as a part of the fibrosis lesion, it was quite an interesting finding because we do not get to see that kind of appearance in mature cement ossifying fibroma regularly. And there are some other reviewers also who are telling that it can be a cementous dysplasia only because mature cemento ossifying fibroma is rarely been presented. So that was the interesting factor that we can open the after presenting the case, we can open the discussion to everybody through your platform. So that's why we chose that case. So it becomes more interesting and more discussion, more reviews can come together.
True. That's good. So, did you get any additional views after the presentation?
Yes, ma'am. Dr. Pratibha Ramani from Savita Dental College, she expressed her opinion regarding cementous dysplasia. But the
Okay.
large size of that lesion, that was also a factor for consideration. And another surgeon from Europe, most probably, I cannot recall his name. He was asking if the margins were positive or negative for the tumor tissue. So so I understood the significance of examining the tissue properly, so we do not miss any region.
Is this the person you were wondering, Professor Hiller? He is asking you now, Dr. Basu, was this the case with the irregular exophytic outline?
Uh, Clinically, sir, there was a little bit of extraosseous growth, but to call it a exophytic, I'm not sure. But yes, surely expansion was there, and a little bit of exophytic was there, and it was the breach of the cortex was radiologically visible in our case. It is from the superior aspect, the mandibular cortex was breached by that growing lesion.
Amazing, Professor Hiller. I don't know how you can remember a case. Okay, but he can, and and he's from South Africa, by the way.
Okay.
Professor Joss is from South Africa. He is a great support to our movement at Oral Pathology 360. He is there almost every week and he will share his views and comments on every lecture and every topic. And he has such a vast experience that it's really great to have him around. Yes, as much that can be learned from him. So, we'll see if he has anything else to say about this. But okay, so Dr. Kugendran, let's come to you. What was the case and what made you choose it?
Okay, as I mentioned before, coming from a pediatric dental background, so I get to see a lot of children and adolescent patients, usually 16 and below. So in Malaysia, we will treat those 16 and below patients comes under pediatric dentist. So I get to see this case of a vascular malformation. So I thought it's very interesting because I think this particular pathological cases regarding the vascular malformations are pretty much common in children and adolescents. So I thought it's something which is very interesting, and it's usually it's not a very straightforward diagnostic cases whereby you have to delineate both clinical, radiographical, as well as histopathological examination is required. So that's when I decided. So I put it in my slide in a manner where how did I actually derive to the diagnosis. So I think probably that what made the presentation rather interesting, I suppose. So I made on how to differentiate between vascular malformations and hemangioma, and I also enhanced, or I actually in fact talked about the importance of multidisciplinary approach and when it comes to vascular anomalies. Yeah,
Oh, well done. It must have all worked, anyways.
yeah.
So,
Thank you.
yes. Okay, Ritika. Yes, it's rare to see an undergraduate presenting anything that's, oral pathology or oral medicine for that matter. So, how come you chose to actually make the presentation?
Ma'am, actually, I'd like to start by thanking you and giving us and me and my fellow mates the opportunity to present. The reason I decided to present in an oral pathology conference goes back to my third year when I was friends with one of my seniors who was studying oral pathology and doing a research herself. So seeing her go through the process made me want to join in as well. And so I approached my mentor with the idea, ma'am, I'd like to work on a research project. So my mentor told me, since I'm a third year and I don't have much clinical background, I could start with a retrospective study. So we dug up the cases from my registry, and I presented a case series in that format. So one of the cases that were there was of adenomatoid or oncogenic tumors, and since we wanted to make the series a little bit unique, we did a scanning electron microscopic study as well as a Gallagher stain study. And this platform gave us an opportunity to present a case series, which I am extremely grateful for.
You're most welcome. Yes, anything else you wanted to say? Sorry.
No, ma'am, that's all.
Okay. So, Dr. Mahalakshmi, what made you choose the case?
Yes, ma'am. So my case is on odontogenic keratosis with dysplastic epithelial lining. And when we go through some literature search, there were only 4 or 5 cases reported so far. And we have also done immunohistochemical staining like pan-CK and Chi67 to evaluate the proliferative index and also to evaluate the prognosis of the patient. And so this is how the case went, ma'am.
Interesting. Yes. Okay. So, Dr. Basu, we have a question for you from Professor Hila. So, he
Yes,
is
ma'am.
asking, was the lesion well circumscribed histologically?
Ma'am, what we received was
No,
in one
clinically
single
it was
piece.
actually a diffuse swelling, ma'am.
Sorry. Okay. Yeah. Tell me, Dr. Basu.
Yes, ma'am. What we received after the excisional biopsy, after the marginal mandibulectomy was done, is a single large specimen. And when we cut it out, we could find that a thin fibrous tissue was separating between the normal bone and whatever we are calling the pathologic bone. So we can say that histologically it was well circumscribed from the normal appearing tissue. But when we saw the radiology, it was not that much of cementosifying fibroma. The classical appearance was not there, but histologically we can say that it was well circumscribed because the whole lesion was excised and the post-operative radiograph also didn't show any kind of recurrence of any tumor tissue or any osteoblast any kind of hyper osteoblastic activity in the radiograph also. So we can say that well circumscribed histologically it was.
Okay. Yes, I think we have to come to Dr. Saikat. Are you supposed to tell us next? Your choice?
Hello, ma'am.
Hello. Yeah.
I'm next to Dr. Mahalakshmi.
Yes, please. Yes. You are supposed to tell us why you chose the topic, the case that you chose.
Well, the case I presented was a case of a CA breast metastasis into the mandible, and primarily the platform wanted to use the platform because of one reason that it is usually the belief that the oral, because I come from a private practitioner group, so it is usually the belief that oral pathology private practice is not something which has many takers in India. So that was one thing which I wanted to put this line into the category of myth. It is not. There are people walking around with various lesions and pathologies, and they need oral pathology services in the private practice in India, which is the mainstay of dentistry in India right now. So, in this case, especially, the patient came with the chief complaint of mobility of tooth. Uh, we tried to ascertain the history of any paresthesia, but it was quite subjective. The only thing patient kept on saying was she felt heavy. So, also, it was an example where various dental clinics collaborated together to put forth a diagnosis that would help the patient to go forward with the optimal treatment plan. It is important for me to mention here that this lady, the clinic with which I teamed up to do the biopsy and everything, was the third one which the patient was visiting. The initial two were ready with their implant kits to take out the tooth and put implants. So my idea of presenting this case was, one, it was a very unusual case, CA pressed into the mandible. Second, how to diagnose it in the absence of any inflammatory features in the mouth, because the only symptoms which we were able to elicit in the patient's mouth were deep pockets. That's it. And even the CBCT came out with probably osteomyelitis. But then we decided not to extract the tooth, go ahead for the biopsy, and then we saw the tissue which we saw. And then we did a series of IHCs and everything to finally, which finally led us to the diagnosis of that this is a case of a metastasis into the mandible from CA breast, which the patient gave history of. So another thing which I wanted to highlight here is, not every time a clinician would be able to actually treat the patient to help the patient. Sometimes you just need to put the patient in the proper track, because that is the same thing that happened with her 7 years ago when we talked to her, that during the treatment of her CA breast, she was moving around here and there. I mean, incisional biopsy from one place, resection sample diagnosed in some other place, chemotherapy in some other place. So once she was with us, we, since we knew that now it is a metastasis and a dental surgeon in a private practice will not be able to do much, and we needed to send it to the higher center. But we made a proper dossier for her, that this is what you want to do, this is what you need to do, and go to the higher center. And with all the records which we are providing to you, the higher center will take your case up immediately for definitive treatment. Otherwise, the patient would keep shooting in the dark here and there. So that is one role which also the private practitioners should play, that even if you're not able to give a proper definitive treatment, put the patient in the line of the proper optimal on the track of optimal treatment. So that is what I wanted to highlight.
Yes, that's very true and very important. And of course, we come back always to what Dr. Daftari always says: never extract the tooth unless you know why you are extracting it. And it is always the
Exactly,
case,
ma'am.
a tooth
Also, when
just
not to
becoming
extract,
mobile.
and
Yes, when not to
yes,
extract. Exactly. Because a
when
tooth
not to
should never
extract.
become mobile with no reason.
Yes,
Yes.
ma'am. Exactly. And there was no mobility elsewhere in the tooth. There was no sign of any periodontitis. The oral health was fairly good, so there was no reason. She was systemically fine, no diabetes and any other such thing, except for the history of CA plus 7 years ago. So there was no reason why suddenly two teeth or three teeth will go mobile. So that was what made us dig into everything what we did.
Yes, very perceptive and very alert. That's very job very well done. Okay, so let's go now with Dr. Jebisha. Yes. So what made you choose the case that you chose?
The case Crepuscular odontogenic, it is a rare disease which mainly occurs in mandible but even occurs in maxilla, which mimic the periapical system. And also, as per literature, it is a third or fourth case which is reported in palate. So I present this case now.
Okay. Yes, Dr. Swetha.
Ma'am, I presented a simple case of necrotizing periodontitis. Hardly we get biopsy of such a case. The case was of a teenage girl. She presented with a whitish plaque, but it was multifocal, involving that is right side lower teeth, both on the buccal side and lingual side. We saw multiple white plaques, which was slowly evolving, but it was associated with pain and gingival enlargement. And she had been to a local dentist and he had given some medication, but she was not relieved. So she came. When we examined, since we saw the case having whitish plaques of different texture. On the buccal side it was looking like a pseudo membrane. On the lingual side we could see that there is it was having a plaque like appearance which was non scrapable. And we could see some amount of attachment loss, bone loss, and those things. So clinic provisionally we thought as necrotizing periodontitis, but we wanted to rule out deep fungal infection as well as proliferative verrucous leukoplakia, as she was a girl without any habits and multifocal plaques which has been surrounding at multiple sites involving the alveolar mucosa. So then we did a biopsy, and biopsy was suggestive of non-specific inflammation, but lot of necrosis of the surface epithelium and bacterial colonies. So it went, we gave the diagnosis as it is compatible with necrotizing periodontitis, and followed by which we did irrigation and debridement, and provided her with mouthwashes and metronidazole for 2 weeks, and followed up this case for around 2 months, and there was almost total resolution. Probably for the bone formation it might take some more time, and patient is under follow-up still.
Yes, interesting. Yes, very often in the more what I should say serious pathologies, we forget the basic ones like the periapical pathologies
Yes, ma'am.
or with the periodontal pathologies. So it's always good to include them too. Yes, it's always good. So okay, now let's
As
come to, yeah. Tell me.
usually if it is diagnosed as necrotizing periodontitis, it is usually sent to perio, and perio department will do the necessary treatment. Hardly we get the biopsy tissues. So in this case we got the opportunity to look into the surface changes of the gingiva which has been affected by anagma.
True. How come you got the case?
uh,
Is the next thing to ask.
the thing is my thesis is on potentially malignant disorders, so I tend to screen all the cases of white lesions and red lesions, which comes as op. So, and the patient came for serological investigations also for our department. I had a thorough look and then discussed with the oral medicine and oral surgery people, and then we decided that this is the best modality of treatment. Do a biopsy, confirm the diagnosis, and then proceed with the treatment, ma'am.
Yes, good. Yes, very often we don't, sadly, don't get involved in all the cases because some cases directly land up in a particular department. That's true. So, okay, so we got to know also why and how you chose your cases. Now, tell me about your, I mean, we intend to, of course, have IODCPC is going to be an annual thing. So there is going to be another one in 25. So, and this was the third one as it is. So, tell me about your experience. What can we do better? What was good? And what can we do better? Let's
Ma'am,
again
this is
start from Dr. Surendra.
Ma'am, whatever you have done is a tremendous task because I anonymously run a small, very small YouTube channel for tech support and computer related things.
Mm,
So I know the hard work and pain you have to carry with you when you are organizing so many people together and you are serving so many people knowledge, spreading knowledge about a subject, multiple sub fields of that area to every single people who are attending. So as far I know, there are around 237 participants. So managing each and every one of them online is a very hefty amounts of task. So whatever you have done, I think there is no question or complaint. However, there is always some task
yes.
space for improvement. So next time, I what I can expect and wish from you that you will conduct a similar session in a much better way.
In better way. So how can it be better? Tell me.
Ma'am, in that the participants who are joining, they have to be a little bit
Hmm,
more apt with the computer and sharing and everything. So the
hmm,
videos you released earlier regarding how to make a video, how to join the conference.
hmm,
So those tutorials videos, the participants must go through
hmm.
them at least once before joining, so they can face they do not face any kind of problem when they are going live or when they are speaking live.
Yes, but the challenge lies in getting people to,
Yes, ma'am. Yes, ma'am. Yes,
watch
ma'am.
or read.
Yes, ma'am.
I have found it very challenging to even get people to read the posters or the details.
Yes, ma'am.
So, yes, yes, but that's a challenge which we are also trying to work on and trying to overcome. Maybe we will find a way by next year. Hopefully, we
Yes,
will. And yes, okay, Dr. Kugendran, what you can tell us how we can improve? What was good and how we can improve?
Actually, for me, I think the conference was really good, and I think it was up to the high tech. And I think it's with the platform, and get to click and get to get to all the various parts within the conference was really amazing. And I seriously have never attended anything similar in online, like how I attended this conference especially. And I think that part was really good. And I think the part that where it can be improved is that especially on the part where all those abstracts, I only get to see the posters being posted earlier, so people can get they can read the posters. But unfortunately, those who are oral presentations, the abstract or anything wasn't uploaded before that. I mean, at least the abstract should be there earlier. Probably all the other conference participant can be able to read the abstract of those oral presentations as well. So they can get more interested to join the particular sessions of presentation, so we can anticipate more participations during the presentations. Yeah,
Yes,
I
that's a
think
good
that's the only, yeah, that's the only
what we
suggestion.
had was a limitation of the platform, because the platform had actually a setup for poster display but had nothing that could be used for the oral presentations or for anything else basically. But yes, we can maybe work on having an external link that takes people to all the abstracts and work on something like that. It's a good idea, yes.
Yeah,
For next year, if we are on the similar platform where there is no ability of doing it on the platform, maybe we can do it externally. That's true. It's a good suggestion. Thank you.
sure. Thank you.
Yes. Ritika, what can you tell us?
Ma'am, I like to say that I have no complaints because this is my first specialty conference. So all of it
Hmm.
was extremely new to me, extremely innovative, extremely approachable, and really simplified. So I like to agree with Dr. I'm sorry, I can't pronounce your
Kugendran,
name.
I
Could
think.
I'd really like to agree with him because the entire conference was a very phenomenal experience for me as a presenter as an attendant. So, ma'am, no negative feedback from my side.
Thank you. Okay. Dr. Mahalakshmi, what can you tell us?
So, first of all, I thank you, ma'am, for giving me this opportunity to present my case over this platform. And I too don't have any negative feedback towards this.
Okay. You should not feel that it's negative feedback. It's a possibility for us to improve and grow. Everything has to improve with time. At least I don't think of it in a negative way. I think it's the thought that someone has, is giving me a chance to be better. So don't worry about it. If you can think of something to say that would improve, please go ahead very comfortably. Yes. Dr. Saikat, what can you say?
Right from the first mail which I got about this conference till the last day of the conference, it was an absolute pleasure for me to be a part of it and everything. But one thing I would like to point out, I completely agree with what Dr. Basu mentioned here, that we need to apprise ourselves more about this technology of YouTube and screen sharing. And somebody like me who has two left feet in technology was able to make a poster all by myself, and which means that the criteria which you had set, the pixels, the photographs, they should be of this much measurement and everything, was so perfect that it was not because I have had problems in some conferences initially where the resolution was going off, and I never knew what to do with a picture whose resolution is not clear, because I have good pictures with me in my laptop, but I will not be able to show it to the presenters over there online. But in this case, this was not there. So that was one thing which stood out for me, that once I was making the poster, it just took an hour for me to put in all the photographs, because the all the measurements which you gave was very apt. And like that, we went ahead and did thing. But one thing, ma'am, is this conference always going to be on online mode? Because if it is offline, then it will be even better for us to meet the new oral pathologists and the
Yes,
interns whom we are seeing here, to meet them personally
that's
and
true.
see how they are faring. So if it
Yes,
can be
that
offline, we'll be even more happy.
Yes. The main limitation that then we would face is then we would become a regular conference, and we would lose the
Yeah.
fact that we can reach across the globe, and we can have speakers from across the globe. If you saw our speakers, why even our case presentations, there was no limitation for anyone from anywhere could take part, could attend. And although I did not expect anyone to actually sit through every live session, because that would be near impossible, some of the organizers did try and did sit through most of it. But for the most part it is not possible. The idea was that everybody around the world would have some amount of it to attend live and to interact live, and then watch the rest recorded. But the main thing is, if we
Yes.
decide to go offline, one is the cost will go up and the access will go down.
No, that was just in a lighter tone web. That's okay. The
Yeah,
online conference
but
is equally good. But
is
again,
equally
there
good.
were
Yeah.
two things which actually stood out for me. Sorry, please, ma'am.
No, please go ahead.
One was because I had recently attended a conference. I won't take names because in that conference, the poster presenters were not given the chance to explain their posters. Usually, the format is that you put up your poster and then people would come, walk around, watch it, window shop it, and then go back. But somebody who has done the work on that particular case would like to talk a few things of that case. That is the yearning which everybody has in mind, but in this platform that was there, that everybody was given a particular time. Secondly, it is not necessary that your case should have big IHCs and um, more important diagnostic features should be there. Very simple case like Dr. Acharya's case, as simple as necrotizing periodontitis that even trained eyes can miss. So all those cases were selected in this platform, and then now we know that how big these cases became by the time the presenter finished presenting the case itself. So that was a good thing, I suppose. Giving equal platform to all. That was the highlight of this conference for me.
Yes, that is essentially part of our, what I would say, our core values is democratizing it. So, yes, democratizing access to everything. So, we are just basically keeping up with that. Yes.
Yes,
So,
ma'am.
Dr. Swetha, what can you say?
Ma'am, I was thoroughly impressed attending this IODCPC conference in 2022, where I was just one among the audience listening to good speakers, notable speakers, distinguished speakers. So I was wanting to present in one of the conference which you organized. So I made it a point. Once the advertisement came, I followed and I wanted to enroll in this conference and do my presentation because I like your format, the instructions you give, and the recorded versions, which are so helpful. You can go back anytime and revise, and it's a good learning experience. Whether it is recording and submitting, or going through various case presentations, or repeated versions of the talks which have been recorded and delivered to us. So really enjoyed the conference, ma'am. Thank you so much for giving a platform like this.
Thank you. We have lost Dr. Thota and Dr. Jebisha. Okay, let me ask you a question. One of our the main difficulty we are facing, or our main challenge, is essentially how to reach more people. For a conference with this amount of facilities and this amount of things that we have done, if you really see about 270 registrations, I would say was too little. So I'm opening it to you all as the people who are at the receiving end. Maybe, I'm blinded and I have a limited vision. What would you think would be a good way of reaching more people?
Ma'am,
Anyone
this
wants to
is
make a
a
suggestion? Hmm. Yes, Dr. Sweta.
um, ma'am, this is a digital symposium where it provided an access for presenting cases which are simple as well as complex. Probably it requires more advertisement. these advertisements were through the social media. It didn't reach
Yes.
individual institutions and the department. It was word of mouth, telling to our
Yes.
colleagues as to such a platform is there, you can enroll. That's how my colleagues enrolled and they presented posters. So further, any other modes if we can use, we can increase the number of participants, especially the undergraduates. Now they are enthused to enroll in any conference
Hmm.
which we guide them. So
True.
it has to reach the staff members so that more number of participation can be possible.
Hmm. Yes. Any other suggestions?
Hi, Doctor. Actually,
Yes.
I came across this advertisement in Instagram while I was just scrolling one of the night, and then it came out
Hmm.
about this conference. It was very sudden, and because I was following this 360 Tuesdays, and then so I think I also followed in Instagram, and that's how I randomly got this name. I mean, like about this conference, and I think it's worthwhile to promote it further. I mean, like what Dr. Swetha said in all these social medias, especially Facebook, Instagram, and I think now everybody's on social media, even TikTok. I am not sure. I think it should be further promoted in those social medias, as well as probably I'm sure that like this the all the professors and all the doctors who join the conferences are from various institutions. So I think they can actually, you can pass it like a formal information to the particular universities or schools, then they can do further broadcasting to the entire school and to all the other centers. I think by this it can be able to reach to more people.
Good. So next time, basically send
Also,
a
I think
letter, email to the institutions. Yes, Dr. Saikat.
we need to rope in more of the teachers in dental colleges. I mean, except for Maulana Azad, I didn't see any college of them from our part of India. So, if we could rope in more of the dental college staff, where they would pass on the message to the PG students and the UG students alike. So, I think students are interested to present the cases. So, I
Yes.
think we can rope in more numbers from
Yeah.
there.
The
Ma'am,
the yeah. Please.
I'd also like to put in an input. Ma'am, during if the next conference arises, we could ask the current people who've attended to repost and increase an engagement on social media. That would help as well, because I found out on WhatsApp through my mentor who guided me to this conference.
True. Actually, we have a reach on various social media and our mailing list. We reach more than 10,000 people. 10,000 people within the field. I mean, not just 10,000 people, but 10,000 who are either oral pathology, oral medicine, oral surgery, in the related fields, basically. But even then, we didn't get. So maybe that is what, like you're saying, is that to just send out more actual. One is more formal invitations to specific institutions, and one is, like Ritika says, is to get people to make sort of videos or pointers as to people's experiences. Yes. Okay, now we have a question for all of you. Professor Hiller says, for this is for all of you. What was the role of the supervisor if you had one? And how much did they get involved? Did they follow you on the conference, or do stop with Let's stop. Or did it stop with the final production of the videos? So essentially, how involved, if you had the supervisor, how involved was the supervisor or the senior colleague?
Ma'am, in my case, the whole department of mine, the senior residents, and all my faculties,
Hmm.
including Dr. J. Augustine, Dr. Priya Kumar, and Dr. Aditya Biars, my HOD ma'am. So every single one of them sat with my case and shared their views when I presented everything regarding that case in front of them. And during the day of the presentation, also, every one of my department has supported me a lot, and they have gone through the whole session when I recorded it and showed it to them. So basically what was that, they just didn't leave that part up to the production of the video. they also took follow up that how the presentation went, and so I am very grateful to them for their continuous support, and most importantly the guidance they have given me.
So essentially, you had full support right throughout.
Yes, ma'am. Yes, ma'am. Right from the beginning, and still now I am getting full support from each one of them.
That's nice. What about you, Dr. Kugendran?
I think I would never even make it without my supervisors, because I had supervisors who are consisting of oral pathologists, oral maxillofacial surgeon, and also my another supervisor from pediatric dentistry unit. So actually, as I mentioned, the multidisciplinary involvement. So we first got the case, and then we discussed it with interventional radiologists, as long as with oral surgery. So every one of them, and in fact, my oral pathology doctor Ayu, she gave me those histological slides, and she actually explained. She took time to explain, what you actually can see, what actually derive you towards this diagnosis, not to that diagnosis, and she was constantly answering all my questions, being that I'm not from that side of it. So I think my supervisors really guided me from the beginning till the end, and I in fact informed them that I won, and they were really very happy about it. Yeah.
That's nice. What about you, Ritika?
Ma'am, again, I'd like to contribute a huge thanks to my mentors and supervisor as well. Ma'am, she was with us from the very beginning. She told us, and through your instructional videos, which we were seeing because our ma'am had instructed us, she's like, everything needs to be in order. It needs to have page numbers. We had multiple Zoom calls and video calls with our in charges. And like ma'am was like a huge support and driving force for all of us to be able to present at this conference. And Mandana ma'am, thank you so much again for giving us this opportunity.
Hmm.
uh, and like I remember re-recording parts and bits and parts of the slide because my in charge, my mentor, she used to tell me, Radhika, that one word doesn't sit right. I need a little bit more voice modulation. I have had sleepless nights. I've been awake till 3 o'clock at night because it was my first specialty conference. I didn't want to make a single mistake, and this was an extremely enriching experience. Especially my mentor, again, who I'd like to thank with my entire heart for giving me this opportunity and guiding me through it all.
It's all right. Now you can say her name. I know Dr. Sandhya did all the work. Yes. We are
Yeah,
not in the conference anymore. Yes.
Sandhya ma'am was a huge driving force for all of us, for all the UG
Yes.
participants.
So, Dr. Saikat, I know you were on your own. So,
Yeah, there was no supervisor for me, but I'll take this opportunity now to tell everybody that usually we get to know or get to hear about the fact that oral pathologists and surgeons have a very happy kind of relationship. But trust me, I think I'm one of those blessed ones who is working in the private sector with excellent clinicians, because we never had an ego issue. Uh, Both ways. I mean, when they are trying to present a case and they want a histopathology photo micrographs, I send them. And in this case especially, and many other cases which we try to publish, the moment I used to call them and say, okay, I'm presenting so and so case in so and so conference, and I need some clinical and radiological pictures from you, before I could cut the phone down, all the pictures will would be in my inbox. So that is one thing. I mean, the collaborative effect was really commendable. I needed to point that out.
true. So, anyway, you had support. Even if not at the supervisor of colleagues, you had a lot of supports. That's very
Yes.
nice. Yes.
Yeah, but
Dr.
yeah,
Jebisha?
of course.
Dr. Jebisha, what about you?
In my case, ma'am, our staff and our actuaries are supported and guided us for this presentation, ma'am, from the beginning to the end.
Okay, Dr. Amulya?
Good afternoon, ma'am. Am I audible?
Yes. Hmm.
I'm extremely
Okay.
sorry. I've been having terrible network issues, ma'am. Sorry for the inconvenience.
That's okay.
Um,
That was why we took
coming
all your
to my
presentations as a
coming
video.
to oh,
Yes.
yes, ma'am. Uh, coming to the person, the driving force for the entire conference for me is Dr. Divya ma'am. She's the professor and HOD of the Department of Oral Maxillofacial Pathology at Geetham Dental College and Hospital. And right from the start day, like the day that I've received this invitation to attend IODCPC, till the end of the day that I've completed the presentation and have clicked on the submit button, she has been my constant support, and she helped me with the entire thing, ma'am. Right from helping me select the topic to how to present it, since it's my first poster presentation, so I had no idea about it, and she's been really kind to help me through all of that.
Very nice. Dr. Acharya, what about you?
Ma'am, we have a good coordination in the department, and I'm being given free hand to go through the case, discuss with colleagues, and interdisciplinary also. And that's how it's possible to present the case, and it was done.
That's nice. So, we have some comments from the audience on how to improve the conference. One is, of course, Dr. Sandhya says UG participation will increase the registration. International conference participation will improve their CV. So, I hope so. And Professor Hiller is suggesting or asking, with the letter to the deans of dental colleges be of value? I guess so. We should try it anyways. And Dr. Aditya is commenting, number of people attending the actual sessions were usually only around 50. We need to increase the visibility. Yes, that is true, but because out of the 200 and whatever our registration was, literally only parts would be awake at that point of time, and only parts would be actually attending the session live. So the actual attending at that point is really not a good judgment of how many were there. But then, as a fact, we know how many registered was some 270 something. So yes, people will be still watching the replays for, and again, in case you all have also, you are not aware or you have forgotten, the replays are available for 15 days, but that's exactly for 15 days. The whole conference, you can watch the whole conference for another 15 days on the same website using the same login. But yes, we need to definitely increase the overall registration more than anything, because I mean, the entire organizing team, afterwards we felt, yes, it was a success, yes, everything went well, and yes, we had great speakers, great cases, but there could have been a lot more people who actually benefited from it, from those presentations, and we need to actually be able to reach that many more people to be able to make it uh, you know more effective. um, because just having a great presentation by itself is not really much point unless there are that many people. It's like having a book that nobody reads. So having a presentation, however great it is, unless there are a lot of people actually benefiting from it, then you do feel a little bit sad, even with all the success. You do feel that. So yes.
Ma'am, you
Okay.
can take the horse, ma'am. You can
Yes.
take the horse to water. It is left up to the horse to drink or not. So you have done your job, and
Yes.
attendees are enriched. Rest is their choice.
Yeah, that's true.
I think
That's
next
true.
time we'll plug it.
Yes. Next time, definitely. There's every year it's going to be there, so definitely next year. And I hope you will all carry good words about it, anyways, and spread the word. So that should also help. And yes, we are reaching the end of our time. You have anything, any message that you want to give, not only just to our attendees now, but to everybody who will inevitably watch this afterwards?
Ma'am, I would like to give one input that
Yes.
from Oral Pathology 360, you can arrange shorter competitions or quizzes or a more interactive
Mm.
sessions which can attract much more undergraduate students. And if they are getting attracted by that, then they will stay for the bigger conference also when they see that other undergraduate students like Hritika Mehta is presenting their cases. So it is it can be very inspiring for the undergraduate students also. That can be done, ma'am.
Yes, definitely. That is true. Anyone else wants to give us any thoughts?
I mean, one message this conference has given very loud and clear to all the PG and UG, not PG as such, to the UG students is oral pathology is a beautiful subject to be into, to practice, and just to be a part of it, to be known as an oral and maxillofacial pathologist. I think this is the word which the young generation should carry from this conference and spread this word.
Yes, and I have to say, Dr. Saikat, much as I appreciate the emotion and the thought, we are now no longer just oral pathology. We are oral and maxillofacial diagnostics, including oral medicine
Yes, ma'am.
and
Absolutely.
oral radiology.
Absolutely.
And in
We
fact,
are
in the coming year, we hope to include
diagnosticians.
oral surgery.
Right, ma'am.
Yes, yes. The
Oral
collective
diagnosticians.
of,
Perfect.
yes, exactly. So the collective
Yes,
of
ma'am.
diagnosis, whether it is done even by a surgeon or by dentist. Actually, I don't know if you have paid attention to the logo I use with every one of our lectures. Is a There's a microscope, there is a genetics, there's a DNA loop, there's a mirror and a probe, there is a CT scan, and sometimes there is a blade. So that actually is the coding of who can watch and who it is for, the lectures. I should probably advertise that a little more so people figure it out better. Yes. And okay, so it's been really great, I must say. Like I said, I don't really very often get to interact with everybody here, but it was really nice interacting with all of you and having you here. And in the conference, I didn't get to interact with you all. I was all the time too hurried and too focused on the sessions running smoothly. But it's great, and I'm so glad you all attended. I'm so glad you presented. I will take away your suggestions, and definitely hope to have a better conference next year, and hope to have all of you come back to that conference. And well, what
Sure,
else
ma'am.
can I say? Everybody follow Oral Pathology
But then you should
Tuesdays.
give,
Yes.
ma'am, you should give us now the opportunity to thank you, because I'm reminded of this movie Lagan. When the movie Lagan, I think it's one of the very famous movies of India. When the movie starts, the first thing that hits is the Sutradhar's voice, Amitabh Bachchan's voice. And then we follow the movie and then we like the character. So Sutradhar has to be strong. So I think our Sutradhar in you was the strongest. The rest just followed. So thank you for that.
I agree with Sir.
Thank you so much. So very kind of you all. Thank you. It helps me to keep
Thank
going
you,
on
ma'am.
and do more. Yes. Thank you, everybody. With this, we shall say
Thank you, ma'am.
bye. And Dr. Bhuvan also
Bye,
says
ma'am.
good discussion. And I think with that, we will just say bye. See you all. See you all
Yes.
definitely, at least in the comments on OP Tuesdays.
Done, ma'am. Thank you.
Bye, ma'am.
Perfect.
Thank
Yes.
you.
See you.
Bye.
Bye.